going to be the PA student assisting with your visit today. Can I get a verification of your name and date of birth?
Emma Klein, April 15th, 1994.
Okay, and we're going to be doing a little bit of history taken and a back exam today. Do you consent to that?
Yes.
Okay, great. So I see you're coming in for some low back pain. Can you tell me about that?
Yeah, I've had it for about 2 years now.
Okay, when? So 2 years ago?
Mm-hmm.
Does anything seem to make it better?
No.
No? Does anything make it worse?
Yeah, whenever I lift stuff.
Okay. How would you describe the pain?
It's like a burning pain.
Burning. Okay, and have you taken anything for the pain?
I tried ibuprofen, it didn't really help. My friend was prescribed hydrocodone, so I took some of those and they helped my pain.
Okay. What does she take the hydro for?
It's left over from when she had her wisdom teeth taken out.
Okay. Where specifically is your pain?
I would say like right
You can point
here.
to it. Okay.
Like on both sides.
Okay, do you feel like it travels anywhere?
No.
Okay. Is it like equal on both sides of your
Yeah.
back? Okay. And how would you rate the pain out of 10? 0 being no pain at all, 10 being like you feel like you're dying?
10 out of 10, it hurts
10
so
out of
bad.
10?
Yeah.
Okay. When the pain happens, how long does it last for? Or is it constant?
It's constant.
Constant, you wake up with it, you go to sleep with it?
Yeah.
Okay.
All the time.
Does it wake you up from sleep?
Yeah.
Okay. And it's that constant 10 out of 10 all the time?
All the time, yeah.
Okay. Do you have any associated symptoms or is it just the pain?
Just the pain in my back, nothing else really.
Okay. Okay. Can you tell me about your past medical history? Do you have any chronic conditions besides the pain?
No, I had my appendix out when I was 24 because I had appendicitis.
Okay.
Otherwise, I have a history of asthma.
Okay. Do you take anything for the asthma?
No.
No. Is it pretty well controlled?
Yeah.
You just stay away from triggers and stuff like that?
Yeah.
Okay. Are you up to date with your medication? Or not medication, your immunizations?
Mm-hmm.
Okay. Are you taking any medications besides the ones that's not prescribed to you?
Nope.
Okay, so no. Have you continued taking the ibuprofen or you stopped when it didn't work?
I stopped when it didn't work. It
Okay.
didn't seem to help at all, so I figured I might as well not take it.
The friend's hydrocodone that you took, do you know the dosage?
10 milligrams.
Okay.
So I was hoping to see if I could get like a prescription for that because it seemed to help me pretty much.
Okay. Do you know of any allergies you have? Besides just the ones related to the asthma?
I'm allergic to amoxicillin.
Amoxicillin, okay. And can you tell me about your family medical history, your grandparents, parents?
My dad has high cholesterol. My mom has depression. My brother's healthy. And my grandma died of a stroke.
Okay. And I'm just gonna ask a little bit about your social history. Do you smoke at all?
No.
Okay, no smoking, chewing tobacco, nothing like that?
No.
Okay, what about alcohol?
Yeah.
Okay, how often do you drink?
Well lately because of my back pain, it's been pretty painful. So I've been drinking about like a bottle of wine a night.
Okay. And what about your sleep? About how much are you sleeping per night?
Like only about like 4 or 5 hours.
Okay.
My pain makes it hard to sleep.
Okay. And then exercise. Are you exercising at all?
No, I don't have time for it with my job.
What do you do for work?
I work at Amazon.
Okay, what do you do?
I am a software engineer.
Okay, so nothing where you're picking up or lifting a lot?
Nope.
Okay. And back to the back pain, was there any trauma that caused it initially, or did it just kind of onset?
Just seemed to have started, really.
Okay. Do you use any illicit drugs like weed or anything like that?
No. Never for me.
Okay. And then, how would you describe your diet?
I'd say I eat pretty well.
Okay.
I try and eat pretty well. Pretty normal.
Okay. And then, would you say you have a good home life, family support, and stuff like that?
Definitely.
Okay. And do you have good access to health care and health insurance?
No.
No?
I actually don't have any health insurance, unfortunately.
Okay, so you're paying out of pocket today?
Yeah.
Okay.
The pain just got so bad I couldn't take it anymore.
Okay. Okay, I'm just gonna do a little bit of a review of systems now. So I know you have the back pain, but do you have any pain in your joints or any weakness associated with it?
Not really, no.
What about palpitations or chest pain?
No.
Are you experiencing any numbness, tingling, depression, seizures, insomnia, tremors, or memory loss?
I mean, my back pain makes it kind of hard to sleep and makes me a little sad, but nothing really other than that.
Okay. Do you have any coughing, shortness of breath, or wheezing?
No.
Have you noticed any rashes, itchiness, or discoloration?
Nope.
Any dizziness, changes in vision, hearing, or trauma?
Nope.
Okay, and then any diarrhea, constipation, or heartburn?
No.
Okay, I'm gonna go ahead and do a couple screening tools. The first one being the ORT. So I'm just gonna have you just answer the questions, okay?
Okay.
Do you have any family history of substance abuse?
No.
And what about family history of illegal drugs?
No.
What about prescription drugs, family history?
Yes.
So do you have a personal history of abusing alcohol?
I wouldn't call it abuse, but some people have said that my alcohol use is kind of a lot.
Okay. And you said no illegal drugs earlier?
No.
Not past use either?
No, just the hydrocodone, but
Okay.
I don't really know if that's legal.
Okay. And do you have a history of any sexual abuse?
No.
Okay. Have you been diagnosed with ADD, OCD, bipolar, or schizophrenia?
I was diagnosed with bipolar, but I don't take any medication for it.
Okay. And what about depression?
No.
Okay, we're gonna move on to the DAST. I'm just gonna ask you a bunch of questions again. In the past 12 months, have you used drugs other than those required for medical reasons?
No.
Do you use more than one drug at a time?
No.
Do you think you are able to stop using drugs when you want to?
Yeah, probably.
Have you had any blackouts or flashbacks as a result of drug use or alcohol use?
From alcohol use sometimes, yeah.
Okay. Do you ever feel guilty about your alcohol or drug use?
I mean, my family thinks it's a problem, so yeah, I do.
Your family does? Okay. Have you ever neglected your family because of use of drugs or alcohol?
I just haven't seen them in a while,
Okay.
so.
Have you ever engaged in illegal activities in order to obtain alcohol or drugs?
No.
Have you ever experienced withdrawal symptoms, which just means feeling sick or not feeling good when you stop taking drugs or alcohol?
Yeah, when I stopped drinking a week ago, I had some bad issues, but I just ended up having some wine anyways, and that seemed to help.
Okay, and have you had any medical problems as a result of your alcohol or drug use, which would be like memory loss, any diagnosis of a hepatitis, convulsions, or bleeding?
Sometimes I don't really remember what I did the night before if I drink a lot, but otherwise, no.
Okay, let me calculate really quick. Okay, next I'm just gonna do a quick little physical exam on you. You can sense that, correct?
Yes.
Okay, I'm just gonna have you stand up for me really quickly. Okay, I'm just gonna feel on you really quickly. Does this feel painful?
Yes.
Okay, what about up here?
No.
Okay, what about down here?
No.
Okay, can you bend over for me really quickly? Did that hurt?
Yeah.
Okay, same area down here?
Yeah, really bad.
Okay, you can go ahead and take a seat. Okay, I'm gonna go ahead and discuss with my attending really quickly, and then I'll be back in with a treatment plan, okay?
Okay.
Okay, so we have Miss Emma Klein presenting with the chief complaint of lower back pain. She's a 24-year-old white female. The back pain onset about 2 years ago. The only thing that makes it worse is heavy lifting, and the back pain feels as though it's burning. It doesn't seem to travel anywhere, and she states the severity is a 10 out of 10, and that the pain is constant. It affects her ability to sleep, and she has tried ibuprofen and it doesn't work. She's also seeking a prescription for hydrocodone because she took some of her friends and insisted that that worked for her. Past medical history is only significant for an appendectomy and asthma. Her immunizations are up to date. She is not taking any current medications besides the hydrocodone. She's allergic to amoxicillin, and her family history is only significant for hypercholesterolemia, depression, and stroke. She doesn't smoke. She drinks quite a bit, and only sleeps about 4 to 5 hours a night because of the insomnia due to the pain. She isn't able to exercise, and she works at Amazon as a software engineer. She does not have health insurance, so she's come in paying out of pocket today. And her physical exam was just significant for lower back pain on palpation. Her opioid risk tool was labeled as high risk, and her DAST was a substantial level of risk. So my plan for her is to go ahead and start with alternating 400 milligram ibuprofen and 325 milligram Tylenol for 4 weeks. Go ahead and refer her to pain management and get her on a topical diclofenac as needed, which would be over the counter, and just explain to her the risks of opioid use. Okay, Miss Emma Klein. So today I'm gonna go ahead and want to start you on a low and slow regimen, just because as you are a new patient, we're gonna wanna establish some more history before we would do anything like prescribe hydrocodone or any opioids like that. Just because they have so many risks associated with them. They're more of like a last case scenario type thing after we've documented trying to control it with less severe medications. So, as well as the fact that you don't have insurance, paying out of pocket for hydrocodone would be really expensive, and I'm not sure if that would be affordable for you. I'm gonna recommend alternating every 4 to 6 hours between 400 milligram ibuprofen and 325 milligram Tylenol, which are both over the counter for about 4 weeks, and we'll have you come back. And then at the same time using a topical Voltaren gel, you can get that anywhere, it's just 1% diclofenac, and rubbing that directly on the area. That should help as well. And then potentially even a vitamin D supplement, because if your levels are kind of low, that can also affect pain. And then I'm also gonna go ahead and refer you to pain management, just because they'd be better they prescribe opioids more readily, so they would be able to help you potentially better with that. And then I'm also also just gonna stress the importance of getting support from family and friends while you're in pain, because it can really affect different areas of your life. And then potentially also having you set up with a chronic pain support group if you'd be interested in that. Do you have any questions today?
No.
Okay, sounds good.